confirmed cases. Code only confirmed cases of HIV infection, illness. This is an exception to the hospital inpatient guideline. Section 2H. In this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV-related illness is sufficient. Patient admitted for HIV-related condition. If a patient is admitted for an HIV-related condition, the principal diagnosis should be B20, human immunodeficiency virus, HIV disease, followed by additional diagnosis codes for all reported HIV-related conditions. An exception to this guideline is if the reason for admission is hemolytic uremic syndrome associated with HIV disease. Assign code D59.31, infection-associated hemolytic uremic syndrome, followed by code B20, human immunodeficiency virus, HIV disease. Patient with HIV disease admitted for unrelated condition. If a patient with HIV disease is admitted for an unrelated condition, such as a traumatic injury, the code for the unrelated condition, e.g. the nature of injury code, should be the principal diagnosis. Whether the patient is newly diagnosed, or has had previous admissions or encounters for HIV conditions is irrelevant to the sequencing. Asymptomatic human immunodeficiency virus Z21, asymptomatic human immunodeficiency virus, HIV infection status, is to be applied when the patient without any documentation of symptoms is listed as being HIV positive, known HIV, HIV test positive, or similar terminology. Do not use this code if the term AIDS or HIV disease is used or if the patient is treated for any HIV-related illness or is described as having any condition resulting from his/her HIV positive status. Use B20 in these cases. Patients with inconclusive HIV serology. Patients with inconclusive HIV serology, but no definitive diagnosis or manifestations of the illness, may be assigned code R75, inconclusive laboratory evidence of human immunodeficiency virus, HIV, previously diagnosed HIV-related illness. Patients with any known prior diagnosis of an HIV-related illness should be coded to B20. Once a patient has developed an HIV-related illness, the patient should always be assigned code B20 on every subsequent admission. HIV infection in pregnancy, childbirth, and the puerperium. During pregnancy, childbirth, or the puerperium, a patient admitted or presenting for a healthcare encounter because of an HIV-related illness should receive a principal diagnosis code of O98.7- human immunodeficiency, HIV disease, complicating pregnancy, childbirth, and the puerperium, followed by B20 and the codes for the HIV-related illness, ES. Codes from Chapter 15 always take sequencing priority. Encounters for testing for HIV. If a patient is being seen to determine his/her HIV status, use code Z 11.4, encounter for screening for human immunodeficiency virus, HIV. Use additional codes for any associated high-risk behavior, if applicable. If a patient with signs or symptoms is being seen for HIV testing, code the signs and symptoms. An additional counseling code Z71.7, human immunodeficiency virus, HIV counseling, may be used if counseling is provided during the encounter for the test. When a patient returns to be informed of his/her HIV test results and the test result is negative, use code Z71.7, human immunodeficiency virus, HIV counseling. HIV managed by antiretroviral medication. If a patient with documented HIV disease, HIV-related illness, or AIDS is currently managed on antiretroviral medications, assign code B20, human immunodeficiency virus, HIV disease, code Z79.899. Other long-term current drug therapy may be assigned as an additional code to identify the long-term current use of antiretroviral medications. Encounter for HIV prophylaxis measures. When a patient is seen for administration of pre-exposure prophylaxis medication for HIV, assign code Z29.81, encounter for HIV pre-exposure prophylaxis. Pre-exposure prophylaxis, PrEP, is intended to prevent infection in people who are at risk for getting HIV through sex or injection drug use. Any risk factors for HIV should also be coded.